and help now. Hey guys, it's Linda, psychiatrist, and I'm so excited that you guys decided to join my channel again and learn more about mental health, psychiatry, and medicine all in all. So if you're wanting to know more information, feel free to hit that like button, subscribe to gain more information with me. So today I'm starting a new series and it's called Mental Health Awareness, and it pretty much breaks down all the diagnoses you possibly have heard outside in terms of depression, bipolar, schizophrenia, anxiety, and I give it to you in an easily digestible form and also be able to help you understand these terminologies. So today we're going to be jumping into depression. So when you hear depression, you probably think of somebody who's very sad and can't get out of bed and stuff like that, but there's so much more to depression than just that. So in the DSM-5 criteria, which is a book that all psychiatrists use in terms of diagnosing patients, the official term of depression is called major depressive disorder. And with this terminology, there is a time span that must be met before we give somebody the label of MDD, which is a short acronym, okay? And the time span is 2 weeks. So now I'm going to go into symptomatology. There are various symptoms that you must meet to be given the criteria of having depression. And I'm going to give you an acronym to help you remember. And it's called ecaps. And that's what I use to help me remember. Hey you guys, so I'm currently at work right now. I'm doing a 24-hour shift and it's Saturday, May 20th. So I work from 8 a.m. on Saturday to 8 a.m. on Sunday. But I did want to continue the discussion that I started in terms of depression and knowing the symptoms that occur with it. So like I said, the acronym that we use is ecaps to identify symptoms of depression. So the S stands for sleep. Some patients complain of too little sleep that they get while they're depressed or too much sleep. I know the regular, how it looks in the news and on shows is like the person who's in bed sleeping all the time, but it can vary. The I stands for interest, and a lot of patients complain about loss of interest in activities that used to bring them joy. Let's talk about cooking or bike riding, hanging with friends, hobbies like yoga. They don't have that energy to do that anymore, that feeling, that drive. Then we talk about G, which is feelings of guilt. And you'll hear patients say, oh, I feel like I'm a burden towards my family because I'm so sad. I feel like people have to always look out for me, or I cause too much distress in people's lives. So that's very common. Then we have energy, and a lot of people have low energy. They don't have the energy to do simple tasks, like let's say taking a shower. That's something simple for somebody who's not depressed, but a person who's depressed, you'll hear them say, taking a shower takes so much energy from me that I just lay in bed until I'm able to do it. And a lot of times they go days without showering. Simple things like putting on shoes, going outside, it takes a lot out of them. Then we go to C, which is concentration, that especially in work and school, that they're not able to concentrate as they were before, and they easily get distracted, things kind of pass their mind. Then we talk about A, which is a big one, appetite. And this can go two ways, but the one that you usually hear is that people end up eating too much when they're depressed, in terms of a coping mechanism. But there's also patients who don't eat enough during this time of depression. So I think that's important to be aware. And then P is psychomotor retardation, which is just a slowing of movement that they have. Everything, they'll notice that they do things slower. It takes them a longer amount of time to do different activities. And S, which is suicidal ideation, and this is just passive or active thoughts of wanting to end their life, not feeling that they deserve to be alive, and that being alive is too much work or energy for them, and they feel like they want to end it all. This can come with a plan and intent, or no plan and intent, which pretty much means methods of how they want to do that. So that's the acronym that I use to remember the symptomatology of depression. And I just want to let people know, whoever is going through depression, that you're not alone and help is out there. There are psychiatrists, therapists, psychologists who want to work with you to get you to a state and level that you feel good about living and give you coping mechanisms. So I hope that little segment was informative. I can speak on drugs and medications and different aspects in terms of treatment in the next video. You guys, I'm having a very, very busy day. I had a patient who fell and hit his head. He started bleeding. And then I had another patient whose labs were pretty unstable. Sodium was very low to 123, and she had an AKI, which is acute kidney injury. So we had to get her up and running and ready to go, be transferred to medicine. So all that document was done. So I had to get her legal papers together, which I did, and also alert the consult resident to know that this patient will be coming. And now I have to type all these notes and document what is going on. So yeah, it's been a busy Saturday. Pray for me. Okay guys, so I'm back in the office and it's time to do our favorite parts, documentation. So I'm just going to be writing a brief note for the patient that's being transferred, because medicine needs at least some documentation, so it can be very short that you write. You don't want to write a whole long history of what's going on. So it's 1:21 in the morning and I just got called for a patient who was pretty much destroying his room, breaking the door. It was a mess, guys. I'm so tired. I have about 7 hours left of this shift and I'm so ready to go home. I cannot survive. Like, it's 6:30 a.m. I just came from a unit and my pager is going off. Oh gosh, an hour and a half left. Hey you guys, I want to thank you guys for watching this video. I was so tired and exhausted to create an ending, but thank you for sticking with me during this 24-hour shift. And if you like this content, feel free to hit that like button and subscribe for more. Hope to see you in the next video. Bye.